So I wanted to do this video a little bit to express my stance on the American health system. So as you see there, that's the heart hospital. Probably the best cardiologists, the heart doctors in Austin are there. And I saw the reviews of the center, so it's probably one of the best heart treatment centers in all of the city of Austin. And very recently, about 6 months ago, I got diagnosed with something called hypertension. Hypertension is basically a heart disease it can be lethal. It's basically called a silent killer, because if you don't treat it, your heart rate starts, your blood pressure starts increasing until a point that you can easily die without even noticing. Right? Like you can wake up and basically die. So I probably got this disease. I actually take really good care of maybe my teeth I don't take as good care of. Maybe my skin and my teeth are the only things that I'm like not as anal about. But I usually do tons of exercise, and I usually put some thought into my diet, especially as far as fruits and vegetables, and just not a lot of processed foods. However, in the States, sometimes it's a little bit hard to just really spend a lot of time just cooking, just because like you just want to be out, and many times like you're just in a rush to do things. So I think it's doable, but it's not as easy sometimes. So long story short, I got diagnosed with hypertension. This came to me as a very unpleasant surprise, and especially because I've competed a lot in sports before, and I just always embraced athleticism as part of my lifestyle. So in order to treat it, this is just the reality of the American reality. So in order to treat it, I obviously needed a little bit of advice from doctors, and I went to the government-run clinic here in Austin, and basically I got seen by a nurse. She was really not a cardiologist, and I really was trying really hard to get an electrocardiogram. Obviously, I don't have any type of health insurance, just a very basic one for low-income people here in Austin. And the nurse, I just kept asking a referral for a cardiologist, and the nurse just went like, unfortunately, we don't have the funds for that. And she basically made the diagnosis based on just one, like a couple measurements of my blood pressure measurements. So, obviously, I was just very upset because I just couldn't get the electrocardiogram, which is one of the best measures to understand what's wrong with the heart. And I treated it with medication. And then I slowly started changing my diet. I had been homeless for a while, so I was actually able to have housing, and because I had housing, I could just control much more of my diet. So I started eating a lot of vegetables, and I started changing my diet. Eliminated alcohol almost entirely, which was one of the main causes that I had hypertension, because I was like drinking like 2 beers a day. I did quite a lot of exercise. You can see here is my bike, and I changed my diet to a lot of green things, and I had a lot less stress because I was no longer homeless in the pandemic. And just through all these efforts, my blood pressure became almost normal. However, the center, I really wanted to follow up on more visits in the center, and I just wanted to get another blood pressure, and it was really, really hard to get access to these doctors. They constantly just wanted to dismiss me, and just getting an appointment was hard. So in general, like if you don't have a lot of resources, you usually are bound to struggle a little bit more. One of the things that really helped me is like I have a biology degree, and I started reading quite a lot. I bought a huge book on hypertension, and after reading quite a lot, I just figured out like what were the main variables behind the hypertension. So I just targeted, I eliminated alcohol, eliminated salts, did more exercise, and increased the amount of green things in my diet, like salads, and decrease the amount of processed food, which has a lot of sodium, and then decrease stress, obviously. So the reason I wanted to show you here this center is because the biggest irony about a non-universal healthcare system is like I was constantly here really close to this hospital because I always come here and have coffee, and there's all these cardiologists that have the best knowledge about how to treat something as simple as hypertension, but I could never get any access to them because I just don't have the insurance. And unless you have a job that has insurance, and this usually means a nice white collar job that pays over $60,000 a year, you're unlikely to get like any type of decent insurance. So you'll be bound to all these centers, etc. And I mean, if I would have been, say, for example, in Costa Rica, where I was born, or in Germany, this type of diagnosis and treatment would have been a lot easier because I would have access to cardiologists with a lot more ease than I would have right here. And I think the sad thing is that I have like a master's degree from the United States, and I tried really hard to get a job that would have health insurance, but I never could, even though I tried for about 10 years. So I just have a sour feeling about how all of this has panned out.